Rhythm of My Heart, and we are talking about arrhythmia, which is a common heart problem where I mentioned that statistics show that 10 million cases per year are diagnosed. And doctor, what are the major causes and its treatment?
Yeah, rhythm distortion, arrhythmia. That's how it is. Arrhythmia could be either where you're born with it, or it could be because of certain medications or drugs or your vices. Let's talk about vices and drugs. You can have arrhythmia in the form of a fast rate or a slow rate. If you have a slow rate, it could be due to drugs, which can cause the heart to slow, and that could give rise to giddiness. A sort of blackout and things like that. Fast arrhythmias can give rise to palpitations. So fast arrhythmias can be induced due to common cold medicines, taking nasal drops, or certain recreational drugs. Nicotine can cause this. So these are induced ones. Those arrhythmias where you're born with, it's called congenital arrhythmias. Those again could be faster rhythms, which are called tachyarrhythmias, or slow rhythm called bradyarrhythmias. Bradyarrhythmias, you lose consciousness and drop to the ground. That's degenerative. So as you age, the programmed body also ages, and the heart rate and the electrical tissues become aged, and the heart rate goes slow, so no blood to the brain, and you pass out. And the effective treatment broadly is implanting pacemakers, which are batteries which push up your heart rate, and then you're back to your rhythm. Faster rhythms called tachyarrhythmias, are purely congenital. You may have lots of diseases with tachyarrhythmias. I don't want to go into the medical details of it, but the therapy basically is electrophysiological study, and there are rhythm specialists who are called electrophysiologists who actually conduct these electrophysiological studies, and then they isolate, that's a switch from where short circuiting is taking place and faster rhythms are generated. Let's go and attack that switch and cause radio ablation, which is a very laser energy implant or applied over there, and the switch is reset and you're back in action. So that's how it is, Bosco, broadly.
Right, but sometimes there are certain drugs that also create bradycardia.
Yes.
Right? Like beta blockers, for
yes,
example.
absolutely, yes.
Are they administered with a purpose sometimes?
That's a great question. Now, beta blockers are absolutely beautiful drugs. They can be used broadly if a patient has got angina or suffered from heart attack, where the rates are very, very fast, and you don't tolerate these fast rates because your quality of life is deranged. You have palpitation. So beta blocker, a sprinkle of it, will actually effectively slow your rate down and makes you feel very, very comfortable. Beta blockers are absolutely great drugs, and there are various classes of it, and it relieves palpitations. So it is a mainstay therapy. It can be used in hypertension also,
right,
basically, as a mainstay therapy, yes.
Right. You talked about angina. Now, mostly angina patients are the ones that have this pain on a more frequent basis, and they always got to keep a tablet with them any time that they require, place it under their tongue, right?
Yes.
And
yes.
Why is that so? Are these blood thinners?
No, they are not blood thinners. The tablet which you're talking about is called Sorbitrate. Sorbitrate broadly is misused. Sorbitrate is a drug which actually increases the diameter of the blood vessels which supply blood to the heart, and thereby relieves angina. Angina is lack of blood supply to the heart muscle. So Sorbitrate should only be taken if you have severe chest discomfort under the tongue. Under the tongue, because it acts in 2 minutes. If you take it with water, then it goes through the gastric mucosa and is destroyed by the hydrochloric acid produced by the gastric mucosa. So you usually take it under the tongue because it bypasses the gastric mucosa, and it acts very fast. It should only be taken if you have chest discomfort and is used as an SOS basis. They are misused because many of them panic and they take it under the tongue. Oh, I've got sweating, I feel vomity, or I have giddiness. It should not be misused. Sorbitrate is not for that at all.
Right. Thanks a ton for telling us about this, because I think a lot of people really would misuse a tablet like that.
Yeah, only during chest discomfort of severe nature, yes.
That's why I guess it's very, very important to listen to your heart. Here's Roxette.